Sleep disorders are disruptions of the sleep cycle or the quality of sleep. We will now discuss the most common sleep disorders. Insomnia is the perception of poor quality sleep, including the inability to fall asleep or stay asleep. Sleep apnea is characterized by a reduction or pause of airflow during sleep. Central sleep apnea occurs when the brain does not send the signal to the muscles to take a breath, and there is no muscular effort to take a breath. Obstructive sleep apnea occurs when the airway becomes obstructed and prevents an adequate flow of air during sleep. Restless leg syndrome is characterized by uncomfortable sensations in the legs and an uncontrollable desire to move the legs, resulting in difficulty falling asleep because of trouble getting comfortable and an increased urge to move their legs. Narcolepsy is a disease of the central nervous system that results in excessive daytime sleepiness and other symptoms such as loss of muscle tone, distorted perceptions, and the inability to move or talk. Shift workers and pilots commonly suffer from circadian rhythm sleep-wake disorders. Misalignment of the circadian clock in relation to environmental cues and the light-dark cycle can bring on chronic sleep loss and disruption of circadian rhythms. Each of these sleep disorders may lead to inadequate or insufficient sleep. All patients should be screened regularly for these common sleep disorders. The most common signs and symptoms of inadequate sleep include excessive daytime sleepiness, unintended napping during the day, difficulty initiating or maintaining sleep, depressed mood, anxiety, irritability, inability to tolerate stress, behavioral or social difficulties, frequent infections, decreased productivity, and poor memory or concentration. These symptoms are common in a number of other conditions, including mood disorders and substance abuse, so providers should maintain a broad differential diagnosis when evaluating a patient with these or similar symptoms. Research suggests that inadequate sleep may have wide-ranging effects on the cardiovascular, endocrine, immune, and nervous systems, including the following: obesity in adults and children, diabetes and impaired glucose tolerance, hypertension, anxiety symptoms, depressed mood, and medication and alcohol abuse. Patients with cardiovascular disease and diabetes are also at higher risk for developing both obstructive sleep apnea and central sleep apnea and should be screened regularly for these comorbid sleep disorders.